Is Mazin Ibrahim. I'm consultant orthopedic surgeon with subspecialist interest in hip and knee pathology. I work within HCA premises, mainly practice at the Princess Grace Hospital, but also I do work within the Wellington Hospital facilities. I chose to become a consultant in orthopedic surgery because I would like to see the results of my actions, and I mean instant results. And orthopedic surgery allows me to do that. For an example, I see a patient with hip pain due to hip osteoarthritis, and they are limping, struggling with their daily activities, and they come to me, I see them do hip replacement, and they walk immediately afterwards, and their quality of life improved significantly. So I can see objective evidence of my actions when these patients, they get the operation and they are happy and satisfied with my actions. The most rewarding thing from my job is patient satisfaction, especially when they are happy, satisfied with the treatment I provided them, and my treatment improved their quality of life. The treatment helped them to be able to do their life activities without any restriction, without any pain. Most of the patients, they come to me with disability related to an injury or related to pathology like osteoarthritis. And when I do the operation for them, this makes them able to be back to their normal activities. And this is the most rewarding and satisfying thing about my job. Thank you very much for the question. The patient, they will come and see me in my clinic for a variety of pathologies. I will greet them, introduce myself, and allow them to introduce themselves to build rapport. I'll start with the history, take detailed history on their problem, and talk a little bit about their past medical history, past surgical history, and what's the main concern and what's the main cause of visiting me. Then I'll conduct physical examination. I do thorough physical examination. Usually patients present with a problem with one joint or two joints. Then I'll examine these joints, but I will carry on a holistic approach where I examine the patient in general, look at their gait, walking, that joint that they are complaining of, but also look at the joint above, joint below, to look if there is any source of pain or any problem coming from surrounding joints. This will be followed by investigations. So the patient expects to have relevant investigations like X-rays, MRI scan or CT scan, and sometimes ultrasound scan. And this will help me to construct a plan about their future management plans and management and treatment plans. Sometimes this can be reinforced with other investigations, not only these I mentioned, but also sometimes with ultrasound guided injection as a diagnostic test. Once I get all that formalized, then I will decide about the best treatment option, whether it is non-operative or operative treatment. And this will be discussed in details with the patient. And if we decide to go ahead with an operation, for example, I need to tell them about everything related to this operation, including risks and benefits. And I go in details with the risks to have a valid and informed consent before we proceed with the surgery. If I conduct any surgery, I will follow them up until they recover completely, and then I will discharge them.